Okay, just a few things here I want to highlight to you in this section, changes in the DSM-5 organizational structure. And I recognize that they're uh, they somewhat here they refer to DSM-5 and DSM-5 TR somewhat loosely. So just we're talking about DSM-5 TR, just so you don't get confused on that. In the first section here, developmental lifespan considerations. That's just really about trying to put the order of the diagnoses in the book, meaning our prop here, in the book, in a sense of some kind of methodical way of creating some strategy to how the diagnoses and the diagnostic sections are laid out in the DSM. I think that's really the only point they're making here. A sub point of that is that's also these similar considerations I've also incorporated into this course in trying to select a subset of the DSM and put it in an order in a way that I hope you will get the most out of to get the most out of this course um, in the semester time that we have here. So that's not something to be tested on. That's just for context. One part that you might want to hang on to in terms of, and this could be a test question, would be the concepts of internalizing versus neurocognitive disorders. Um, and really, the internalized versus externalizing is here's where it's important: is internalizing a phenomena or something you have to that your client will want to talk to you about. And of course, you're going to read that in lots of different ways in body language and stuff, but they're going to convey that to you. Where externalizing uh, phenomena will be more something that you observe than they talk about. And they may relate behavior to you they may seem as they're puzzled why that was a problem, and so you're sort of digesting that, like taking that in, and okay, you're observing, and sometimes you will get this won't happen so much but this will happen in a small way here and there in our virtual case studies. But there are times where you may have a lot of adjunct information coming in when you're doing an assessment. You may have legal papers, you may have a referral from another practice, a referral from a hospital, that kind of thing. Sometimes you have no adjunct or external data. Other times you might have a bunch to go through. Um, when it's logistically possible, it's good to do that before you see the client, if it's at all possible for you to be able to do that. Okay. And neurocognitive disorders, just a word about that. They are not exclusively conditions of people who are older, 65, 60s, 70s, and 80s. That's where the majority of them manifest, meaning those conditions. But I definitely have seen people develop neurocognitive disorders earlier, much earlier in life. That's much more rare, but it does happen, just so you know. And then lastly, I just want to make sure you know what the International Classification of Diseases is, and what it is, and there, and also the point that DSM historically used to exist from a classification standpoint, classification and coding standpoint, used to exist completely separately from the ICD, which for decades has been the most widely used, and continues to be, as far as I know, the most widely used method of diagnostic coding. And that's for billing and lots of other healthcare transactions, and even beyond, healthcare, other like social welfare systems. There are some instances where these coding, the codes are utilized. And so, just to add an extra little bit of context here, Dr. Tedros is the current head of the not the ICD, the World Health Organization. He was featured a little bit more prominently during COVID in terms of media. So you might have seen him on the news, or in some media forum during COVID talking about vaccines and other COVID related matters. But anyway, he just provides, I think it's like a 2-minute description of what the ICD is in his point of view. So nothing you'll be tested on, just a little bit of extra context there for you. So hope you find that helpful.